GDHS 2025 is the biggest healthcare summit in the country and the most impactful digital health summit in the world. With the World Health Organization as knowledge partner, it is recognized by MedTech as the official pre-summit of the AI Impact Summit 2026. Supported by Ministry of Ayush, NHRC, the Global Coalition of IGF on Digital Health, Digital Economy, Environment and Gaming for Purpose, Bhashini, Denmark as country partner, and Government of Telangana as state partner, this is the only summit where history and the future are created at the same time. At Mumbai's Geo World Convention Centre, healthcare history was made. The fourth edition of the Global Digital Health Summit 2025 was not just about digital health, it was about reset, a complete reimagining of how we heal, care and save lives. It brought together 2,053 visionary leaders from across the globe, with an expo showcasing breakthrough technologies and the prestigious Global Digital Health Innovation Awards honoring industry pioneers. GDHS 2025 set a new benchmark for the future of health. Day one made history as GDHS 2025 became the first summit to host Dr. Vint Cerf, co-creator of the Internet and Vice President and Chief Internet Evangelist at Google, as chief guest. From the opening ceremonies to groundbreaking discussions, Day one went beyond dialogue to reimagine healthcare from the ground up. The day began with visionary leadership setting the stage for transformation and charting the future of digital health.
Any technology that has created opportunities has created jobs. And I think all of us unanimously agree, AI is creating phenomenal opportunities, so it will create phenomenal jobs.
And digital twins, another complex topic. You can be your own control group for a new clinical trial. And it would say, yes, if you did these 5 things to your lifestyle change, this is how it would impact your future chronic illness management, etc.
A reset is not a touch-up. It cannot be accomplished with a press release or marketing campaign. A reset demands imagination, it demands risk, and it demands creativity.
Day one witnessed an address from one of the fathers of the Internet.
These are just some of the ideas that come to my mind, and perhaps you'll have many, many more as well. But one of them is obvious, and that is using diagnostic tools, having AI systems trained to look at imagery, to detect cancer, for example, or other kinds of diseases. Another possibility, of course, is to synthesize drugs rather than just doing many, many different random trials to figure out what might be effective.
The first summit, which pioneered having patients take the stage and recommendations based on their personal experience.
We should be looking at the patient-centric approach, not just the hospital or the corporate or the doctor-centric approach to medical advancements and all that.
How do we get a system in which these frontline people can reach a doctor right away after the first 5 minutes and stabilize the patient?
Autism is a personality, a way of being. What defines me are my passions, my discipline and my achievements.
दुर्बल बीमारियों से जूझ रहे बच्चों को फ्री मेडिसिन दी जाए, उनके माता पिता को स्पेशल फाइनेंशियल सपोर्ट मिले और हेल्थ इंश्योरेंस में ऐसे बीमारी को कवर किया जाए.
Major role played in the porphyria health journey is just the digital health, because that's when I could connect to more patients, where I found support, some care, and I could even access injections through that.
The day's most provocative session, a broken health system, can digital health fix it, drew a packed audience as leaders confronted systemic challenges head-on. Populations are turning to the Internet and public health must also transition. The conversation in this session focused on taking public health to the digital age, exploring data, medicine and education as the cornerstones of transformation.
Public health is high touch and low tech. That has changed. And in private healthcare, it's high tech and low touch.
Protect the idea of data as a public good. And this is really worrying, not just as a foundation to informing policy, but as a foundation to accountability and public awareness of what's happening.
The keynote that followed focused on how digital medicine and data-driven care can transform health outcomes worldwide.
Investing in your suite guarantees returns. You're looking at one of the worst sleepers on the planet. I've never liked it, but to see what it's done for my health, using my own data as an intervention to show me that I'm taking care of myself, has been pretty profound.
The afternoon session explored how AI is reshaping the future of medical specialties and clinical practice.
Patients come into my office all the time now. They think, and many times they're right, but they've figured out what they had. And they're testing me to see if I have done my Googling and or ChatGPT or whatever it might be. And then I'm not just some old guy with white hair who hasn't caught up. So interacting with people in that environment is so different than it used to be.
The last 2 years, we have been testing in what we call the AI lab, and together with partner, clinician, and major hospital system, how our generative AI could have worked and could work in the correct way.
Radiology is about patients, people, passion, and definitely a predictive science where we are going to predict how the biology of the tumor or of the disease process is going to affect us.
I think the smartphones and wearables are changing the way we look at overall preventive health, future health in living long.
The session handled the most important discussion of the do's and don'ts of regulation, intellectual property and compliance in digital health, as failing one aspect would mean failing on the rest.
India became a country where our regulations, policies came first and products came later.
The ambition is that every citizen of this country should have a unique healthcare ID, which is then linked to the complete health record.
So when we talk about the area, from AI-enabled diagnostics to wearable device and breakthrough vaccines, India is rapidly becoming a hub of innovations.
I personally feel healthcare is a reputational thing. It is based more on a foundation of a patient's trust.
The challenge for a startup and perhaps even for hospitals is that generally these people on the ground, they're not aware of the nitty-gritties.
Next up was the most anticipated session on agentic AI, exploring how intelligent systems could transform the future of healthcare delivery.
And with the advent of agentic, there's a new hope because now there MP an intelligent planner, router, which can actually wade through these complexities, various portals, various data structures, and keep track of the child doing.
Agentic A2A framework can be the ultimate interoperable framework that we have seen.
The last session of the day answered a hard-hitting question. Is AI in healthcare real progress or just hype?
We all heard about AI. I mean, we've been hearing about AI for the last how many hours today itself. And there's this question that always comes to mind is it real? Is it just a hype? Are we able to make money? Are we able to invest? Or is it just a thing that will pass on?
Today, 50% of the world population has zero access to healthcare. The other 50% has problems with quality, accessibility, affordability.
So the biggest challenge to make AI as a tool to be used is the data set. This data has to be very, very validated. A very narrow data set will not be making AI real.
We do have to admit that we have problems with data.
So we focus on if we basically do the value chain, and what's the value chain in life sciences and healthcare? It's actually the patient.
Alongside the main stage, Day 1 also featured powerful spotlight sessions under the summits of Summit. the National Summit on Mental Health, Digital Health and Human Rights, with Shri Bharat Lal, Secretary General of the National Human Rights Commission, as chief guest, brought together leading experts from across India. The discussions addressed critical mental health gaps, challenges and how digital technologies can strengthen the ecosystem. The multi-stakeholder consultation on India's One Health Policy Framework, hosted by Health Parliament, an influential global policy think tank in collaboration with Brook India, brought together leading experts from diverse organizations and multilateral bodies. Together they discussed key strategies, insights and best practices shaping India's upcoming One Health Policy Framework. The certificate masterclasses featured focused discussions with global leaders on pivotal issues. Mr. Amitabh Nag led a session on building multilingual digital platforms powered by AI. Dr. Milind Antani spoke on the DPDP Act's implications for doctors, hospitals and the pharma industry. Celebrating the power of innovation, ambition and success, India's most prestigious awards honoring outstanding entrepreneurship, visionary leadership and the extraordinary achievements of the Indian startup ecosystem is back. IDFC First Bank presents the Economic Times Startup Awards 2025. Join us as we celebrate the trailblazers, the disruptors and the dreamers who are driving India's startup success story and inspiring the next generation of entrepreneurs.
We are the fastest growing large economy in the world today, and personally I see the next 3 decades will be India's time and will continue to be the fastest growing large economy for a long time into the future.
There were waves of startups coming up. The best of ideas, without capital doesn't work, and India should figure out how to expand the capital base.
Watch the 2-part series at these times only on ET Now. After a historic Day 1, Day 2 of the Global Digital Health Summit 2025 carried forward the momentum under its theme, Tech-Driven Implementation Across the Ecosystem. Day opened with Dr. Rajendra Pratap Gupta setting the tone for collaboration, innovation and the urgent need to turn digital health vision into reality.
Brilliance is not enough. You need to have an ecosystem.
Complementing this, Day 2 also featured opening keynotes that set the tone for practice-driven, people-first digital health.
If you integrate stress management, sleep, nutrition, fitness, all in one multi-dimensional program, it's a lot better than doing these things individually. When you link that to a bigger purpose, then these things are often also easier to build into your daily life.
We have to provide in all areas, cities and the rural, the access to all the devices, all the possibilities to access to the digital health.
And across the day, keynote addresses from India's top policymakers and global thought leaders added momentum to this theme.
There is a scope and there is opportunity for this collaborative framework, this kind of ecosystem to develop, where government is going to play the role of regulator and more importantly facilitator, basically including protection of patients' interests as well as privacy. Also private sector, which is basically developing models and implementation, these things. Civil society as a community mobilizer and international organizations and bodies as knowledge and technical support partners.
Very often there are several cases in India, several diseases that go undiagnosed because we are not able to provide specialist doctors in remote areas. Like for example, tuberculosis remains to be a big killer in India. And very often in remote areas, we do have hospitals, we do have X-ray machines, but we don't have quality radiologists. So we have AI-enabled solutions which can solve this problem, which can read the X-ray images and give diagnosis that is required.
When we think about Ayush system, it is generally in our minds, it is said that some traditional medicine practitioner, and then they are claiming big. But when we gel with and integrate with digital technology and bring in AI component into it, this huge scalability is possible in different areas, not only research, in public health, in education, regulation, in standardization, and so many other things.
We are trying to build up a voice-first system, which actually takes you to a different level of collaboration, innovation, as well as communication, because you do it in your own language and other person also speaks, writes, or does it in own other language.
India on fire. Indian people running these software companies in America. We continue and build a nation because of all the nations I go in a year and see them. We are on the right foot with the right leadership for economic growth, and we all can participate in that growth going forward.
Healthcare should be constantly evolved. This whole notion of AI, data-driven decision-making, precision medicine, they're all words, but we're actually putting them into practice. What we're trying to do at Mayo Clinic is to move more and more care into the home, away from a physical infrastructure.
Next up was the session on how will artificial intelligence impact the pharmaceutical industry, a conversation that went straight to the heart of innovation and regulation. The session was chaired by the Drugs Controller General of India.
Wherever I think that human intervention is required, I think AI can be used, at least theoretically, and people like you have to actually make it practical and demonstrate to the world that yes, it is possible.
Let us also remember that AI is here to stay. Predicting early intervention, if artificial intelligence can do, we would have created a much bigger step for pharmaceutical industry, and that's where we should go.
AI can play a role in molecular modeling. AI can play a role in database through clinical trials, understanding the patient reactions, understanding the patient movements, understanding how we can improve in terms of our restructuring of molecular database.
Data is really important, regardless of whether you use AI or not AI, and to really have data-based decisions. Otherwise, you're going to end up causing more harm than good oftentimes.
Putting AI in front of our field analytics and the sales force has really helped us with a very targeted strategy to make sure that the medicines can get to the patients sooner and faster, and the physicians can prescribe to it.
Moving on, the next session talked about the future of medical education. With rapid advances in digital health and artificial intelligence, leaders examined how India must reimagine training doctors, nurses, and healthcare managers for the future.
There is a huge need of quality education in the new format. Now education is not about degrees. It's about lifelong upskilling. That's how education is going to be. We don't have to reinvent every 3 years. We have to reinvent every year. The world is changing every 6 weeks. You can't wait for 3 years. That's not the way it is going to be.
The future batches are going to be our nurses always willing to learn the new things. The Indian Nursing Council preparing our nursing professional for the future in the upscaling in the digital health, and they should be able to work effectively in hand with the other team members in the healthcare delivery system.
If we don't teach the new tools, I think we're going to be dead. The medical science is advancing so fast. If we don't teach them about IoT, I'm saying not only AI actually, even IoT or robotics or otherwise, we'll not be able to survive.
Nurses who are currently working in the healthcare ecosystem, they are also going to onboard in the digital health system. Nursing informatics is now an era of essential. It's not a optional.
We academics must evolve. We must learn the fact that lifelong skilling is no longer an option. It's a time when innovation in education must match the innovation in health.
You can't separate out the health delivery with medical education.
Today, it's not just about AI in education, but it's also about educating AI.
One of the most talked about sessions of day 2 asked a tough question. Will AI lead to layoffs in healthcare? With automation reshaping industries worldwide, the panel debated whether digital health would displace jobs or create new opportunities.
India doesn't have a problem of efficiencies. India has a problem of putting 10 people to work. And how should we think about that globally? And that's a real question on the table.
So I'm giving you the data of how AI has created jobs in the state of Telangana. This is one of the world's leading life sciences clusters with over 2,000 companies. In the last few years, they have attracted $9 billion of investment and created 200,000 new jobs with AI. So it's not that everything is bleak and bad.
Layoffs are for jobs. Layoffs need not be for people. And that is something we have been learning over the last 35 years of technology invention or invasion in our daily workplace.
The doctors, I don't think the nurses will ever be laid off, because one thing that is very important for humans is compassion, empathy, which you can never ever get from any AI machines, that's for sure.
We would anticipate there being an improved need for patient efficiency and care. We experience that there's going to be a lot of workforce challenges, and there's going to be some operational efficiencies that are going to need to be had.
AI will be, in fact, a relief and not a replacement.
Moving on, the next session looked at the future of hospitals in the digital age. The session delved into the important question, will hospitals be confined to just the operation theatres or move beyond?
The idea of the modern practice at an academic institution is very different than it would have existed 5-10 years ago, with, again, software developers and data scientists actually embedded in clinical practice.
So using AI capabilities to be able to assess if a patient's going to potentially get up out of their hospital bed and move around. And so with AI, we would be able to see that and predict that before a human eye would be able to do so.
If we are to be the Vishwa Guru of healthcare as we aspire to be by 2047, that will be achieved when a villager gets access to high quality, affordable emergency healthcare within 20 to 30 minutes of his house.
Everything that we want aspirationally as a human being for the technology to do to us is to keep us out of hospitals.
Next, the focus shifted from hospitals to wellness and prevention in the age of AI. This session explored how technology is moving care upstream, from treating illness to predicting and preventing it.
What is really going to come in is tailor-made precision therapy for different neurodiverse conditions, and that's what we are driving towards.
Moving on, the next session explored the future of medical apps and devices in the age of AI and IoT. From wearable sensors to connected devices and multilingual platforms, the panel discussed how innovation is redefining the very definition of medical devices and patient care.
The world of IoT has changed everything that we know of today. Like, everything is connected, either through Bluetooth or through Wi-Fi.
Device which gives good, favorable results will be taken as the trusted device, which is not the good thing.
Autonomous AI for diabetic retinopathy screening in primary care. It has reduced the stroke, by almost stroke time to decision. Many a times it has to happen in a golden hour, and that has been reduced by almost 20%.
Moving on, the session focused on the important and often neglected topics of customer acquisition, convergence, revenue models and pricing. It discussed how digital health solutions can remain both innovative and profitable in a competitive market, and how to leverage pricing strategies for success.
Pricing is a science more important than marketing, and there has to be a sweet spot. If you price it very high, customers don't come. Price it too low, profits don't come. Balance sheet year after year should tell you where you are, not the PR coverage.
A business person needs to first say, have I found a need that I can serve? And then say, have I now have a product that can really serve that need?
While we talk about digital health, the important word is first health, then care, then digital, and how that digital mixes with the offline delivery of care. So that is on the business model. It has to blend into what is existing and build trust on it.
You have to serve 4 Ps of healthcare. 1 P is obviously provider,
the other is payer, the third is patient, and the fourth, which was exceptionally new to me, was policy or a public health.
Day 2 also featured high-powered forums that deepened the conversation on healthcare's digital future. The Global Healthcare CIOs Forum by HIMSS India chapter brought together leading technology and healthcare executives, highlighting how CIOs are becoming central to strategy and transformation in the AI era. The National Medical Education Summit reimagined how India must train its future healthcare professionals with discussions on integrating AI, VR and immersive innovations into curricula and building stronger industry-academia policy linkages. And the Global Summit on Data-Driven Health positioned data and AI as the backbone of future healthcare, with global leaders calling for interoperability, real-world evidence and equity to drive a patient-centric ecosystem. Beyond the sessions, the Global Digital Health Summit offered exclusive access to an expo where global pioneers unveiled breakthrough digital health solutions. Attendees experienced first looks at transformative technologies set to advance healthcare and reshape the way the world delivers care. The Digital Health World Cafe over the years has become a vibrant hub where leaders connect in an informal setting, sparking fresh ideas, collaborations and partnerships shaping the future of healthcare. Leading CEOs, global leaders and policymakers were seen having conversations over coffee. Day 2 of the Global Digital Health Summit 2025 lived up to its theme, tech-driven implementation across the ecosystem. From regulation and workforce to hospitals, devices and business models, the discussions charted clear directions for action. Day 3 has concluded, bringing startups, breakthrough innovations and global icons into focus. In our next episode, we'll take you inside those highlights, including the much anticipated keynote by cricket legend Ajinkya Rahane. Stay tuned.